I am Arnold Smith, MD. My specialty training is in radiation oncology. Because I was the first physician in the state of Mississippi with special qualifications for radiation therapy, it was politically possible for me to employ biologic cancer treatment in my cancer treatment. I treated several thousands of cancer patients over some 40 years of medical practice. Unless a referring physician specifically objected, patients receiving radiotherapy from me typically receive some form of biologic therapy from me. Cancer patients may be divided into those patients with surgically removable tumors or resectable tumors and those who are not surgically removable. Patients with non-surgical lung cancer are by far the majority. These non-surgical patients usually receive radiotherapy and can be treated systemically with two fundamentally different approaches: chemotherapy and biologic therapy. Systemic options. Firstly, chemotherapy, or a direct attack medicinally on the cancer, may be attempted using a great variety of pharmacological agents. This is the most common and conventional approach. Because chemotherapy typically has toxic side effects, convention may be suboptimal, that is, worse than worthless or harmful. The second approach, biological treatment, consists of restoring or enhancing the patient's own elegant natural immunity. Quality of life during biological treatment is typically much improved by the employment of this method. Surgical support or biological support is a very rarely employed approach. John Reese's story is one of a successful biology and immune-driven treatment cure. This video describes biological support methodology that can result in cures. John Reese was an extraordinary African-American individual on 3 counts. Firstly, John was the loved and respected and supportive father of 11 children. A picture of John with his loving wife and several of his children are seen here. Secondly, John was a lifelong lover, strong advocate, and influential promoter of jazz music as a motif of great and peculiar importance to the Black American experience. A memoriam highlighting John's jazz career appears at the end of this medical video. Thirdly, for over 20 years, John remained in a protracted remission and clinical cure from very advanced lung cancer. The several medical agents and suspected immune mechanisms operative are described here. I do not believe in medical miracles. John's cure developed during both intentional physician intervention and serendipitous accident with intravenous cimetidine or tegomet. This cimetidine seems likely to have played a crucial role in John's medical history. John was a smoker. He did not trust physicians. John presented for medical care at the age of 47, almost 50 years ago, and fatally ill. John's abdomen and feet were swollen, his liver was enlarged, he was very short of breath or dyspneic, and he was very weak. And he was vomiting blood, which is called hematemesis. This is John's chest x-ray when he arrived on 4/3/78. Chest x-rays are read as though the viewer is face to face with the subject. This makes the left chest appear on the right side of the chest x-ray. This initial chest x-ray reveals a huge abnormal left heart shadow, see arrows. This proved indicative of abnormal fluid in the pericardial sac around the heart. The left lung, located just inside The ribs had shrunk or had atelectasis to a crescent-shaped residual shape and was non-functional. There was a white opacity in the left lung base, indicative of abnormal fluid collection or pleural effusion. Prominence in the root of the left lung, called hilar prominence, suggested obstruction from bulky tumor in this location. There was haziness around the outside of the left lung, indicative of abnormal fluid or pleural effusion. Mediastinal structures normally centered were shifted to the left chest due to partial collapse of the left lung by bronchial obstruction at the left hilar region. These X-ray images indicate three main mechanisms were operative and concurrent, causing John's severe clinical illness. Firstly, John's left chest showed much less air than normal in the lung because the left lung was substantially collapsed. Secondly, the heart shadow was very excessive. See the arrows. Thirdly, there was fluid in the left chest, more arrows, left chest base, more arrows, and appearing as a haziness around the left lung periphery. The pathology report indicated lung cancer. The pathology of John's predicament was evident. The great vein returning blood from the lower body, or the inferior vena cava, was compressed. John's swollen feet, distended abdomen, and enlarged liver were caused by this obstruction to the heart, or the cardiac pump of the heart or cardiac pump of blood returning to the heart through this great vein. If blood flow is partially blocked from pressure around the heart preventing efficient pumping, pressure builds up downstream to the heart's incoming blood. Venous hypertension, a very serious disorder, results from this obstruction. John's vomiting of blood, or hematemesis, was from stomach hemorrhage due to stress of his advanced cancer combined with venous hypertension. A syndrome of insufficient oxygenation in the blood can result from one or more of several main causes and can be fatal. Causes here are abnormal fluid in the pericardial sac around the outside of the heart compressing its excursion. Number two, bulky nodes in the root of the left lung or hilar region, causing mechanical obstruction to airflow. And number three, collapse of a lung or atelectasis due to obstruction in the root of the lung or the hilar region. And four, bulky nodes and soft tissue cancer deposited between the lungs or in the mediastinum. In John's case, marked accumulation of abnormal fluid in the pericardial sac or malignant pericardial effusion was the major cause preventing proper expansion of the heart. This was called pericardial tamponade. Fluid around the left lung or pleural effusion, pericardial effusion, and bulky tumor spread around the great vessels located between the lungs or mediastinal infiltration were all contributing to cardiopulmonary dysfunction. That's the heart and the lung dysfunction. The chase-like area between the lungs or the mediastinum contains nerves, the esophagus or swallowing tube, large arteries, the aorta and the large artery to the lungs, or the pulmonary artery, carrying blood away from the heart, and great veins returning blood to the heart. Emergency surgery. First thing to do is try to get John's heart working. John had emergency initial surgery. An opening in the fluid-filled sac around the heart, or a pericardial window, was created, allowing pressure from the malignant pericardial fluid to abate and allowing the heart to expand normally. The tissue around the heart was biopsied. A postoperative chest x-ray of 4/14/78, and that's almost 45 years ago, was much more normal and now showed marked decrease in the enlarged heart image. Less abnormal fluid around the lung, but prominence in the root of the left lung remained. The midline structures, or the mediastinum, had returned to midline position. Compare this with the initial chest X-ray, which you saw. After initial surgery, John underwent a surgical procedure, or mediastinoscopy, to see whether the tumor was present in the upper mediastinum. Mediastinal biopsy was positive for metastatic tumor. A pathology report after this procedure describes what was seen microscopically. The fluid around the heart, or the pericardial fluid, was positive for cancer cells. Tissue from the pericardial sac around the heart revealed infiltration with cancer cells. The fluid from around the left lung, or the pleural effusion, was positive for clumps of adenocarcinoma cells. One of many thousands of such tumor colonies in pericardial and pericardial fluid is shown in the center of this image, surrounded by normal red blood cells. Stage of John's lung cancer. Lung cancer is classified as localized or extensive using a staging system. John had what's called extensive stage disease by several criteria. Tumor had spread to the pericardium, pericardial fluid, soft tissue in the mediastinum, or pleural fluid makes the cancer extensive and deemed incurable. Surgical excision or resection for cure was impossible. After hospital admission, John began constant cimetidine or Tegomet infusion to treat his bleeding gastric ulcer. Cimetidine was a new drug at this time, having been introduced only 1 year earlier in 1977. A radiotherapy consultation was requested to treat extensive mediastinal involvement, hilar adenopathy, and bulky parahilar chest disease. This treatment was intended to debulk gross disease and delay symptomatic recurrence. I decided to treat the pericardium, the mediastinal tumor, including nodes at the root of the hilum of the left lung. John initially received 3,000 centigrays. Centigrade is a unit of dose, in 10 treatments over 2 weeks. A cobalt-60 machine was employed. John's cimetidine infusion was continued throughout his hospitalization for 2 weeks of radiotherapy. Biological intervention. At my initial inpatient consultation, I prescribed gonadal hormones of estrogen, Premarin 1.25 milligrams, with methyl testosterone 10 milligrams twice daily, or BID. Both of these agents increase muscle mass and are anabolic. Lung cancer is regularly associated with weight loss. The Veterans Administration system has studied such weight loss and found weight loss markedly worsens prognosis in lung cancer. Estrogen is a well-documented macrophage stimulant. Macrophages are part of the host immune system. This combination is not feminizing, no breast enlargement. This single pill hormonal combination has now been discontinued by Ayerst, that's the drug company, due to FDA regulation. But separate agents are now available and easily prescribed. Vitamin E 400 international units twice daily was also prescribed as an anticoagulant, and because of anti-cancer activity in animal models, the hospital, we don't know what form of vitamin E they used. Tumor-associated or paraneoplastic abnormal clotting, thromboembolic phenomena, is a common significant side effect of lung cancer, and vitamin E has anticoagulant properties. John's philosophy. John refused flowers in his room. He was offered chemotherapy as treatment, but he adamantly refused. John also refused negative vibration visitors that might discourage him or damage his resolve. and determination to survive. John wanted no pity. John's natural enthusiasm and determination began to reinsert themselves. John quit smoking. He kept the flowers out of his room. Clinical course during radiotherapy. John received an initial 2-week course of radiotherapy in 10 fractions or 10 treatments, Monday through Friday for 2 weeks. Cimetidine as a constant intravenous infusion, permanent with methyl testosterone, and vitamin E were continued during this hospitalization. John was discharged after his initial radiotherapy was complete. His discharge medications included cimetidine by mouth or pills for his gastric ulcer. Cimetidine by constant infusion, critical? That's the question. Cimetidine has powerful anti-cancer immune stimulative effects. This was not recognized until later. It is as a suppressor or T-cell blocker, or suppressor T-cell blocker. This immunologic function was not understood when John was receiving cimetidine for his bleeding gastric ulcer. Cimetidine continues to be a powerful, underutilized anti-cancer agent, although the evidence of its usefulness is compelling. You should refer to the Life Extension Foundation's journal's review of articles on cimetidine with references to study this further. John's treatment and status after emergency hospitalization. Almost 6 weeks after hospital discharge, John returned to the radiation therapy department in apparent good health. His syndrome of abnormal abdominal distension and dyspnea were gone. John's attitude was very positive. His incisions were well healed. There were no supraclavicular or other enlarged lymph nodes. He had no metastatic pains. Feet and abdomen were no longer swollen. John received another 3,000 centigrade in 7 fractions, or 2,100 centigrade, to the same large fields. John was prescribed ascorbic acid mixture, or AAM, as described by U.M. Cameron and Linus Pauling from the Vale of Leven study. This dose, after Cameron's recommendation, was 1 tablespoon of ascorbic acid mixture 4 times daily. This AAM dose contains 10 grams of vitamin C as the sodium salt. This is an alkalizing preparation due to the sodium it contains. Premarin 1.25 milligrams with testosterone 10 milligrams twice daily was continued. Provera, or medroxyprogesterone acetate, 10 milligrams twice daily was prescribed. In 1978, medroxyprogesterone acetate was associated with more spontaneous remissions than any other reported agent. Cameron's vitamin C formula as the sodium salt is vitamin C powder, 100 grams, available from the Life Extension Foundation, sodium bicarbonate or baking soda, 48 grams, cherry syrup, 2 tablespoons, and water quantity sufficient, or QS, to make 600 cc's. Pharmacists can make this easily. Allow for effervescence during compounding. That's made bubbles like carbonated water. Dispense in brown bottles if possible. Do not seal bottles tightly, as carbon dioxide continues to be produced after the formulation and a sealed container may explode. John's chest x-ray of 11/15/78, 7 months after presentation, was surprisingly stable. John's chest x-ray of 11/15, there was an outline of his treatment field, but no pleural effusion, no enlargement of the heart shadow, and no hilar enlargement or hilar adenopathy. Because John's survival was so extraordinary, John's pathology slides were reviewed on 8/3/82 for a second opinion by Dr. Roger R. Helger, pathologist for the Mississippi Baptist Medical Center. Dr. R. Helger's report describes cancer cells in pericardial fluid around the heart in mediastinal biopsy, in pericardial sac biopsy, and in pleural fluid. All specimens showed cancer of glandular origin or adenocarcinoma. Still, a final interpretation was obtained from Raymond Yesner, referee for the pathologist for the Veterans Administration Hospital, and this was several years later. Dr. Yesner's diagnosis was the same as Dr. Arhelger. Cimetidine 300 milligrams 4 times daily and gonadal hormones Premarin 1.25 milligrams BID and methyltestosterone 10 milligrams BID were continued. Vitamin E 400 international unit was continued. Ascorbic acid mixture 1 tablespoon daily, 1 tablespoon 4 times daily was continued. Discussion. It's well to remember that lung cancer, the most common cancer, and other cancers are very rare under the age of 40. Lung cancer is typically caused by highly reactive, promiscuous, fire-produced pyrochemicals in cigarette smoke. In addition to smoking, lung cancer has as its principal cause the change of life, which occurs in both sexes at about 40 years of age. Lung cancer and other carcinomas are relatively rare under the age of 40. Cimetidine is a potent blocker of suppressor T cells. It's a T cell blocker. An interval increase in lymphocyte maturation, including helper T cells and natural killer NK cells, occurs after cimetidine is begun. This is evident as a percent labeling of blood lymphocytes. The percentage goes up. Refer to Life Extension Foundation websites for a review article on cimetidine and cancer published in their magazine in May of 2007. Cancer is predominantly a disease of post-reproductive life cycle. In the early reproductive years, ages 14 to 38, immunity to most cancers exists. Lung cancer is very rare in reproductive adulthood, despite decades of high exposure to cigarette smoke carcinogens. Smoking induced lung cancer is typically deferred during the window of reproductive competence. I exogenously, or from the outside, replicated reproductive adult gonadal hormone physiology in John's management. The macrophage system is stimulated by vitamin E. See Life Extension Magazine review article. Vitamin E also invigorates dendritic cells. See a recent article from MD Anderson Hospital entitled Vitamin E Can Boost Immunotherapy Responses by Reinvigorating Dendritic Cells, close quotes. A critical cell population for cancer recognition. Google vitamin E, dendritic cells, and MD Anderson for this further information. Abnormally increased clotting is a common presenting sign of cancer. Deep vein thrombosis of the legs, heart attacks, and thrombotic strokes occur with increased frequency in cancer patients, especially with adenocarcinoma. Vitamin E has anticoagulant properties. The mechanism of action of ascorbic acid mixture is unknown, but the macrophage system appears to be intimately involved. Ascorbic acid mixture is not the same as vitamin C, and you shouldn't try to substitute it. Cancer patients regularly lose weight. The VA system has research indicating much worse prognosis for cancer patients who have lost weight, significant weight. Methyltestosterone encourages weight gain, as does progesterone, progesterone, and the muscle mass increase, or the anabolic effect. The exact methodology of the extraordinary results reported by Ewan Cameron and Linus Pauling from the VALA study with ascorbic acid mixture has never been systematically repeated. Cameron and Pauling were neither liars or fools. This is a gross neglect of the medical system, who have ignored repeat of this work. Ascorbic acid mixture with its spontaneous breakdown products is in substantial quantity, not tablet vitamin C 3 grams daily as described in a Mayo Clinic study, appears to be essential for the anti-cancer effect of vitamin C described by Pauling and Cameron. Follow-up. John continued to return for follow-up visits in excellent spirits and without significant immediate residual side effects of his hospital ordeal or his medication. John, as a great lover of jazz music, had founded the Black Arts Music Society, or BAMS, that gave concerts in public parks. He taught the kids in school. John always had an ongoing intense interest or passion. John was back on the scene. At some point in ensuing years, bromocriptine mesylate, or Parladale, was added to John's regimen. John continued ascorbic acid mixture, 1 tablespoon 4 times a day, cimetidine 300 milligrams 4 times a day, Premarin 1.25 milligrams with testosterone 10 milligrams twice a day, Provera 10 milligrams twice a day, and vitamin E 400 international units twice a day, year after year. John's activity level was up to his old self or better. John did develop cardiac dysfunction later in life as many years wore on. He developed significant shortness of breath with exertion, but he continued an enthusiastic and productive lifestyle with no cancer recurrence. Chest X-ray of 8/23/84, 6 years after presentation, showed no evidence of cancer. Because John's continued survival and apparent good health was so extraordinary and potentially unbelievable, we got this review study from Raymond Yesner. And Raymond Yesner was the referee pathologist from the VA administration cooperative studies, and he said he also said it was adenocarcinoma. And here's a quote from Dr. Yesner. Quote, scattered through the pleural fluid are small clumps of cells, which in places form rosettes typical of papillary tumor. These are consistent with the papillary tumor seen in the other sections which we have previously reviewed. There could be no doubt John had extensive lung cancer, just no doubt at all. John's case is proof positive that very extensive lung cancer is capable of durable cure or remission. Without cytotoxic chemotherapy or direct medicinal attack. Objective evidence of persistent immune activation. Almost a decade after John's remission, a lymphocyte subset analysis was obtained. This study revealed natural killer or NK lymphocyte percentage well above the normal range. John continued to take medroxyprogesterone acetate, cimetidine, vitamin E, ascorbic acid, and his gonadal hormones. John liked to swig his vitamin C from the bottle. He didn't exactly measure a tablespoon 4 times a day, but he was a little bit more ad lib. John's quality of life was excellent. He continued his vigorous and enthusiastic approach to life. These are pictures of our meetings several years after his remission. These images reflect our gratitude for his protracted remission. John's ultimate death, some 21 years after extensive lung cancer remission, was from cardiac disease and not cancer. I was an honorary pallbearer at his funeral. Over 2 decades of his survival, John never let his heightened immunity revert to normal. On subsequent occasions, in other patients, the initiation of cimetidine was associated with a marked interval increase in helper T lymphocytes, helper T lymphocyte percentage, natural killer percentage, and in pan-T lymphocyte markers. Cimetidine is a suppressor T cell blocker. Cimetidine and vitamin E have great potential as components of a multi-agent biological treatment for cancer. Summary of John's biological response modifiers. Initial hospitalization, cimetidine infusion. At time of radiotherapy, vitamin E twice daily, equine conjugated estrogen or Premarin twice daily, methyltestosterone 10 milligrams twice daily. And at the time he came back 6 weeks later for his second course of radiotherapy, he started ascorbic acid mixture, a tablespoon 4 times a day. Still later, he started bromocriptine 1.25 milligrams twice a day, and medroxyprogesterone acetate 10 milligrams twice a day. There are more reports of so-called spontaneous remission associated with, there were more reports of spontaneous remission associated with medroxyprogesterone acetate than any other medication at the time that John was being treated. MPA, like methyltestosterone, is anabolic and encourages muscle mass and opposes cancer-related weight loss. Bromocriptine is a growth hormone or GH secretagogue. It causes the body to secrete growth hormone. Growth hormone is the trophic hormone of the thymus, and the thymus is the master gland of immune recognition. A dose of 1.25 milligrams of bromocriptine is regularly associated with reports of increased physical strength in cancer patients. GH increases muscle mass. GH has multiple diverse useful functions. Larger doses of bromocriptine are immunosuppressive, and larger doses are clinically unwise. Interested persons are encouraged to Google vitamin E and dendritic cells by Yuan et al. At MD Anderson Hospital for report and bibliography with the access to multiple recent articles on the subject. These letters, Exhibit 15, document some of my correspondence with Linus Pauling and Ewan Cameron and my continued interest in the biological treatment of cancer during the years following John Reese's unusual extended survival. A diagrammatic expression of combined immune treatments is in this diagram. All immune components of this composite phenomenon and interactive mechanism must operate for it to function youthfully. A diagrammatic analogy is drawn with an automobile. All components are required for a working machine. Any single components will not perform. Discussion. What seems dysfunctional is the long interval it has required for science to recognize, analyze, and exploit so-called anecdotal experience in cancer cure. Pauling once said, "Something is wrong with the system." Patentable agency or novel drugs has dominated and suppressed immunological treatment methodology. The presumptions of orthodox medical oncologists and their entrenched nihilism to multi-agent biological approach to cancer care do not reflect empirical scientific evidence, in my opinion. In my opinion, convention is therefore unscientific. The disdain of orthodox medicine for multi-agent simultaneous immunostimulant regimens in cancer treatment is self-serving, reactionary, and serves to retard progress in cancer treatment. Do not underestimate the strong incentivization of medical oncologists and hospital administrations to participate in clinical trials of novel medications, which are patentable and monetizable by pharmacological corporate supporters. Hospitals and physicians both get major financial support from the pharmacological industry. Just as there is a military-industrial complex, there is a big pharmacy cancer care complex. It may be argued that ready patient access to cimetidine perturbs all clinical studies of novel cancer treatment drugs. Opinion. Animal species to survive have evolved elaborate innate systems for control of invasive life forms, mostly bacteria and fungi, but also cancer. Immune-driven cancer emissions are a certain phenomenon. Cancer emissions termed anecdotal, extraordinary, or spontaneous are immune system phenomena and have much in common with recovery from infectious illness. Such emissions are driven by the by the concurrent operation of innate systems for cancer recognition and cancer eradication. Most modern chemotherapy treatments will either disrupt natural immunity or delay initiation of host-driven intervention. Effort to activate natural host immunity should almost always precede direct frontal treatment for most solid cancers in adults. An effort to augment and exploit natural systems as primary cancer treatment is long overdue. Lymphocyte subset determinations should be pivotal in assessing success in host immune activation. Natural killer percent and helper T cell increase, or percent increase, are evidence immunotherapy is trying to assert itself. Good method starts from empirical observation, not authority or convention, and all treatment conventions must remain open to doubt, criticism, and revision. Anti-competitive dynamics of biological treatments. There is a wide competitive moat around the clinical use of most chemotherapy and biological agents. A layperson has no opportunity or authority to personally employ them independent of the physician community. Physicians monopolize their clinical use with exclusive prescription authority. Not so with some biological agents. Vitamin E, cimetidine, and ascorbic acid mixture are all available over the counter to knowledgeable public. Premarin and methyltestosterone are both prescription drugs with medical specialists, with medical generalists as gatekeepers. Parladel, and that's not ergoloid methodoids, that's bromocriptine, that's a misprint. Parladel and Provera, or medroxyprogesterone acetate, are prescription drugs. Successful patient access to a comprehensive biological approach such as I described is not easily secured due to competitive politics. A radiation oncologist staffing a middle-sized radiotherapy center where other radiotherapy centers are not present, as I was, has a moat around him which allows some freedom of independent prescribing. Sometimes, or oftentimes, a certificate of need is required for a new radiotherapy center, especially in Mississippi. A knowledgeable physician can insist or buck the establishment by sheer determination. Ewan Cameron, for his Vale of Leven study, was an isolated surgeon with a good anti-competitive moat. Subsequent analysis of treatment outcome. A subsequent retrospective analysis of several hundred non-surgical, non-small cell lung cancer patients from the Mississippi Baptist Medical Center and from the University of Mississippi Medical Center demonstrated a biological response therapy benefit as described herein to be superior to chemotherapy with a p-value of 0.0001. That means it's statistically very significant. The study was suppressed. Patients must be knowledgeable and very assertive to achieve access to the treatment described here. It has documented efficacy on a much larger scale. Review. Immunotherapy for metastatic cancer. Establish proof of principle. Exhibit 17 of the JAMA, March 23 through 30. Volume 271, number 12, page 945. That's Exhibit 17. The next section has to do with John's family life. And his daughter gives that discussion with me. And following that, there is a written discussion of his jazz interest, which is pretty extensive. And John was a real leader in the jazz promotion business. He was he was very, very committed and enthusiastic about jazz. Alicia, you are John Reese's daughter.
Yes.
And I have a picture of John right here, which we'll get put into this video. And I just found out that you're in this other picture.
Yes.
And that's little you when you were about 3 years old. And John had actually gotten over his acute illness with cancer, but you were only 2 when he was in the hospital with cancer.
Yes.
And this is when you were 3.
I was a little older, yes. Mm-hmm.
It looks like you too, huh?
Yes, thank you. I am my father's child, yes.
Right. Well, tell us what it was like being your father's child.
Wow. Dad was an incredible man. You know, a loving man, family man, and being in his home, it was a beat on the walls in the morning telling us all to rise and shine. The curtains were open. The sun had to come through the windows every morning. The jazz was playing. You know, Dad was just always up and at it. So that is one thing I remember most. You could not sleep in late. You had to get up, be productive, and that's what the mornings consisted of.
Would you say he was a positive sort of guy?
Very positive in his thinking, you know, always instilling that knowledge of self. So yes, absolutely.
And you remember him very positively as a child growing up, huh?
Yeah, I do. We loved our father. Laughing all the time, jokes. You had to have tough skin because Dad's sense of humor, you know, was quite different. So yes, funny guy.
Well, we've got another picture of John with a number of his family, including you,
yes,
as a little girl, and we can show that. And you're in the front, down low, because you were just 3 years old.
Just a baby.
Just a baby. And you're 47 now, so it's been 48 years since John went in the hospital. And when he went in, he was almost dead. He was very, very extremely ill. He couldn't breathe. His feet were swollen. His liver was swollen. He had a bleeding gastric ulcer, and he was sick. And what do you remember about that? You were so little, I guess you don't remember much about that. You were just 2. You remember anything about that?
I remember at some point in time, there was a scar, and he would ask us to scratch it. That I do remember.
That was in the middle of his chest?
Yes.
That's where they went in to decompress his heart.
So I don't remember much as far as seeing him in such a bad state or what that recovery looked like. It was only later on when he would speak about it and make reference to it. But for sure, that area that he had that incision would bother him at times.
Mm-hmm. Mm-hmm. So what you remember about him, of course, you'd wake up to jazz music?
Oh, absolutely.
You had to have that jazz going, huh?
Yeah, you had the jazz going at night. My father read every night. So you would see him constantly cultivating his mind, again, instilling just the principles of being a good human, how to give a firm handshake, you know, looking a person in their eyes, your mentality of that mind over matter is one thing that for sure, you know, stands out with him. That's who he was. So yeah, I remember all of those principles of just being a good human, being a good person.
Principles of John, huh?
Yeah, principles of John. His wife, his family, and his jazz. You know.
Well, I am impressed with Ellen's lasting affection for her husband. Yeah. She seems to have never failed to be one of his advocates, and that's good. I mean, that's a guy that can keep the loyalty of a woman after he's in the grave is pretty nice.
If the way I refer to it, as to this day, she waves his flag. Our children get to hear about their grandfather because of my mom. That love is still alive and well, and I'm so thankful. She's a great example of just what you described, that loyalty.
Now, what kind of work do you do now?
So right now, I'm a massage therapist.
Massage therapist?
Yes, I'm a certified massage therapist back home. Mm-hmm.
I see. And you're from which part of California?
Los Angeles.
Los Angeles.
Yes, the big city.
The big LA, huh?
Yes. Mm-hmm.
Mm-hmm. You like living in LA?
I prefer the South. It's okay, but the hospitality and just the family values, the slow pace, you just can't compare it. So I've been coming here in the last couple years regularly, and it's home. So you can't compare it. It's home.
All right. Well, so I think your mother wants to commemorate John, and so she's had to do with getting some articles in the Advocate.
Yes, the Jackson Advocate.
The Jackson Advocate about him, and they've been real good articles, and we'll include a copy of those articles at the end of this video. So I just wanted to I wanted to let people know what John was like as a person, mm-hmm. because I saw one side of John which was very pleasant, very positive, very dynamic. Mm-hmm. He was a person of pretty strong opinions, and did you say that, too?
Absolutely, yes.
He was things. There was a way to do things and a way not to do things, mm-hmm. and he wanted it done his way.
Oh, absolutely. He could just capture your attention and maintain it just through his presence, and he was a thinker. And I remember one thing he would say: think fast, move slow. So he wanted you to really think before you spoke. And it was just, self-educated. He could talk about anything. Think fast, move slow. Mm-hmm.
Reminds me of an old saying that says, measure twice, cut once. Mm.
He had a lot of different, sayings, but most importantly, just knowledge, and to have it and know how to apply it. If there was a problem, there's a solution to every problem. So I would say,
so he was scholarly, right?
Self-taught, scholarly, yes.
He read a lot, huh?
Every night. My father would read different books.
Did he read to y'all or just read to himself?
I don't recall him reading to us, mm-hmm. but he would be in his chair in the living room reading, and we would see that, mm-hmm. and we would hear the jazz playing. And he ran a calm, peaceful home. And a lot of not having where material things go, we didn't miss a beat. And I would say, to describe my father, one of the richest men, wealthiest men I've ever met, just in his being, his presence. So yeah, he's missed, he's loved, and the flag, we continue to wave his flag.
Mm-hmm. Well, I don't know what else we need to say. This is going to be the introduction. I'm going to have a lot of a medical history after this, mm-hmm. and rather extensive medical history, because I've got enough to be pretty informative about it. And but I thought, since you were in town,
yes,
I need to get you over here.
I appreciate it. This means so much to not just me, but all of my siblings, my mother. It means a lot.
You got anything else we need to say about John, or about the situation?
To this day now, a lot of what he was instilling, when you're young, you don't quite comprehend. But being 47, being a mother, all of our children, my siblings, it makes sense now. He was ahead of his time, just with regards to healing that belief in your body's ability to do what it needs to do. And so, just a great man all around, and a blessing to be able to say that's my father.
Well, he was his medical history is quite extraordinary, and it's become more interesting as time has gone on. It's never gotten the I would say publicity or that it deserves, because well, I've got a letter here from Linus Pauling, or Linus Pauling's associate, Ewan Cameron, and where he says that he's never known anybody that lived over 5 years with adenocarcinoma of the lung.
Oh, wow.
And they're the people that are advocates of high dose vitamin C.
Wow.
And he was a surgeon himself, and he'd also read extensively. But it was extremely rare at that time. Now that was back in about I think 82 when he was writing to me. But there was a survivor for what, 21 years he lived?
Oh yeah, yes.
For a survivor of 21 years after a presentation with all that cancer around his heart, and about dead, that was quite unusual, extremely unusual. So, all right, dear.
Well, I thank you again. This is a blessing, and I'm grateful to you for what you did with my father as well. So thank you.